Hey guys, hi, welcome to Unacademy. This is Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you. I'll just confirm once if the live stream has started. Do let me know in the chat section if the live stream has started or not. Am I visible to all of you? Am I visible? Just let me know if I'm visible to everyone. Okay, great. So, yeah, welcome to Unacademy Future Doctors. I'm your educator for biochemistry, Dr. Shivangi Shukla. I'm conducting a super fun series that will revise the entire syllabus of biochemistry we have completed over the course of this whole month. So, every month during the last week of the month, I take out for revision. Okay, last month I started the rapid revision series, and this time I'm going to start with the 2QPD, that is the 2 questions per day series. By discussing 2 questions per day, I'm going to revise the entire syllabus of biochemistry. Now, this 2 questions per day, I'm going to take 3 sessions. So, and each of these 3 sessions will have 2 questions. So, in essence, you will be covering 6 whole questions per day. So, these 6 questions will have a lot of retrograde analysis along with that. So, we are going to cover a lot of syllabus. Okay, understood? I'll quickly take you through the different types of subscriptions for NEET PG that are available on Unacademy. You can either choose the iconic or the plus subscription. Both of them will give you access to video lectures from top educators across the country, and you can access the live as well as recorded classes, PDF notes as well. The iconic subscription will give you access to resources from Prep Ladder as well. And do not forget to put in the educator code DRSHUKLA Dr. Shukla to avail an additional 10% discount, because today's scenario where online learning has become the most regular way to continue studies, I would really ask you guys to do consider this, because otherwise what will happen is the regularity and the discipline that is needed in studies, it gets lost. Okay, so do consider this, and it is available at very inexpensive rates, and additional 10% discount also you can get. If at all you want the subscription for free, then do not forget to enroll in the NEET PG Combat. Okay, this NEET PG Combat is happening tomorrow on the 23rd of January at 11 a.m. Okay, do enroll using my code DRSHUKLA. Just open your Unacademy app and enroll in the combat section using my code DRSHUKLA. The enrollment is absolutely free. All you have to do is you have to trust your gray cells and you have to attempt this quiz. Okay, now the top ranker is going to get 100% free scholarship in the plus subscription, and the top 10 rankers are going to get 75% scholarship. Just 25% of the amount they have to pay, rest 75% scholarship. 50% scholarship for top 50 rankers, and 25% scholarship for the top 200 rankers from 51 to 2. So can you see 25% discount we'll be getting. So you will only be paying for 2/3 of the amount. Okay, sorry, for 3/4 of the amount. 1/4 of the amount will be totally free. Okay, so it is a very good way in which you can utilize your skill, your intelligence to avail the discount. Okay, so please do consider this, because the enrollment is absolutely free tomorrow, January 23rd, 11 a.m. Okay, I hope you guys appear in this, and for those who for the others, they are offering a lot of coupons as well. Okay, Okay, so there's no loss. It is a total win-win situation. Alright, and one more thing I will tell you guys before starting with the 2 questions for tonight. I have posted a quiz on the Unacademy app. Okay, there you have to enter the code 704816. Okay, this is the code that they will ask. Just open your Unacademy app. Okay, go to the self-study section. Okay, at the bottom you will find a self-study section. Click on that on the Unacademy Learners app. Then you go to the live quiz section. The live quiz section, go to take a quiz. Okay, just now, right away. Okay, do that. Take a quiz. Okay, now what will happen is they will ask you a code, an invite code for the quiz. So the quiz that I have hosted there, the invite code is 704816. Okay, so put this and you will join the quiz, and then I'll start with the quiz. Okay, so I want all my live learners to go and join that quiz. I'll start with the quiz right away, and then I'll start with my 2 questions per day series. Okay, so all of you do go to Unacademy live quiz, take a quiz section and put in this code 704816. Come on, right away. Alright, so I'm starting the quiz. Alright, so while I wait for others to join in, let me just start with this session so that we don't waste much time. I'll just start with this session only. Okay, and then we can wait for the others to join in this live quiz. Okay, got it? So you know the drill, you know how to do that, and then you can continue. Okay, so yeah. So I'm going to start with 2 questions per day right now. The first question is, come on, look at the screen, and I want the answer in the chat section. All of you should attempt it. Okay, which of the following is the most common enzyme involved in galactosemia? Okay, which of the following is the most common enzyme involved in galactosemia? All right, you look at it and tell. A. Galactokinase, B. Galactose 1-phosphate uridyl transferase, C. Aldose reductase, or D. Epimerase. Okay, all right, got it, understood. Are you guys following this? Do let me know in the chat section, guys. Please be interactive. Okay, so I'm giving you 2 minutes for this question. Which of the following is the most common enzyme involved in galactosemia? A. Galactokinase, B. Galactose 1-phosphate uridyl transferase, C. Aldose reductase, or D. Epimerase. Okay, now one hint is that all of these are involved in galactose metabolism. I don't know if that hint is helpful or not, but okay, anyway, don't blame me. Alright, now can you tell me the correct answer? Anyone? The chat section, guys, tell me what is the correct answer. Okay, so the 2 minutes are up, I think now. Shall I tell you the answer now? The correct answer is the most common enzyme involved in galactosemia. Galactosemia means when galactose accumulates inside the body. Okay, there is improper metabolism of galactose, and when galactose starts accumulating inside our body, the most common enzyme involved is galactose 1-phosphate uridyl transferase, or GALT. In short form, it is called GALT. And the second most common enzyme is galactokinase. Okay. Alright. Now I'll tell you the metabolism involved behind it. Okay. Suppose, what is galactose first of all? What is galactose? Come on, tell me, what is galactose? It is a monosaccharide, isn't it? Galactose is a monosaccharide because it cannot be reduced into further simpler sugars, to further simpler compound. Okay. Galactose is formed after digestion of lactose. Lactose is a disaccharide. That means it is formed after condensation of two monosaccharide units. What are these monosaccharide units? Glucose plus galactose. Okay. Now this galactose cannot be broken down into further simpler sugars, but it can be converted into glucose. Okay. So the metabolism of galactose into glucose is what we are going to read right now. Okay. Understood? Understanding? Now this is galactose. Galactose and glucose are epimers or not? Tell me. Galactose and glucose have the same structure except for the fourth carbon. At the fourth carbon position, they differ at the position of OH and H, above or below the ring. So galactose and glucose are epimers at the fourth carbon. Now this galactose will be converted to galactose 1-phosphate. That means at the first carbon position, phosphate has been added. Now, whenever phosphate addition or removal is there, what is the enzyme that is involved? What is the most common enzyme involved with phosphate? It's called kinase, and the substrate is galactose. So, the enzyme will be galactokinase. So, this is the enzyme involved here. Galactokinase is going to add phosphate on the first carbon of galactose. Okay, understood? Now this galactose 1-phosphate, what will be its fate? This will be converted to glucose. But how? Not so easily. Glucose 1-phosphate. How will it be converted to glucose 1-phosphate? The enzyme involved here is galactose 1-phosphate uridyl transferase. Now you will have understood, if you have this idea, if you have read that properly, the conjugation of bilirubin inside the liver, if you have read that properly when I discussed it in clinical biochemistry, if you have understood the synthesis of glycogen properly when I taught you that, then you will know what is the function of uridyl transferase here. What happens is, here comes UDP glucose molecule will come. This UDP glucose molecule is coming from glycogen cycle. Okay, this UDP glucose molecule will come and it will form UDP galactose. UDP glucose will form UDP galactose, and at the same time galactose 1-phosphate will form glucose 1-phosphate. Okay, so UDP molecule will take away galactose from here and it will give its glucose to this. So UDP and this phosphate are exchanging their partners. Okay, that is what is happening. Galactose 1-phosphate and UDP are exchanging their partners here. The galactose was phosphate's partner, phosphate का friend है galactose, और UDP का friend इधर आया था glucose. ठीक है, UDP ने अपने friend को बोला अब मैं तुम्हारे से friendship नहीं रख रहा हूँ, now I have another friend that is galactose. phosphate ने बोला ठीक है, मेरे friend को इसने ले लिया तो अब मैं उसके friend को ले लूंगा, उसका friend है glucose. अब बन गया glucose 1-phosphate और इधर UDP का बन गया UDP galactose. Understood this? Okay, and this is the enzyme that we were talking about. This is the enzyme that is most commonly involved in galactosemia. The deficiency of galactose 1-phosphate uridyl transferase leads to accumulation of galactose 1-phosphate because it cannot be converted into glucose 1-phosphate. And then through feedback inhibition, it will increase galactose also. It will prevent further formation of galactose 1-phosphate because it is getting excess. It is getting in excess. So it will then prevent this reaction from occurring, and then in turn it will cause accumulation of galactose also. Got it? Now, what will this glucose 1-phosphate do? This glucose 1-phosphate, if you remember the glycogen cycle, it will be converted to glucose 6-phosphate by the action of which enzyme? Phosphoglucomutase. That means mutation of the phosphate position over the glucose compound, over the glucose structure, glucose ring. Okay, phosphate has moved from the first carbon to the 6th carbon. Now this will be acted upon by glucose 6-phosphatase, which is also a very, very important enzyme, and it will form glucose which can be utilized. So this is how galactose, this was starting molecule was galactose, this has converted to glucose here. Understood? Now, whenever there is deficiency of galactokinase or there is deficiency of galactose 1-phosphate uridyl transferase, what will happen? This galactose molecule will increase. Okay, its concentration will increase. So then what will happen? This galactose is going to be converted, this galactose is going to be converted into which compound? It is going to be converted into this galactose is going to be converted into galactitol. And what is galactitol? As the name suggests, this is an alcohol. Okay, the galactose is an aldose, galactitol is an alcohol. So alcohol is a reduced form of aldose, isn't it? Carboxylic acid is the most oxidized form, then it will reduce to form aldehyde or ketone, then it will reduce to form alcohol. This is what we read in organic chemistry. This will oxidize to form aldehyde, and then this will oxidize to form carboxylic acid. So here this galactose is getting reduced, aldose, aldehyde is getting, aldehyde sugar is what? Aldehyde monosaccharide is called aldose. So this monosaccharide, this aldose is getting reduced to alcohol. So the enzyme will be aldose reductase. Got it? Understood? Now this accumulated galactitol, this accumulates in the lens, and in the lens it is going to cause an oil drop cataract. What is this type of cataract called? Due to galactosemia, oil drop or oil droplet cataract. It appears as shining like an oil droplet. Understood this? Now one more thing is, you saw this conversion of UDP glucose to UDP galactose. So what is the enzyme involved here? The enzyme is epimerase enzyme. Okay. The enzyme is epimerase enzyme. Understood? So this question is done, completed. Next, this is the next question. Look at this carefully. Okay, are you following this? Look at this question carefully. In which of the following conditions will tyrosine behave as an essential amino acid? Alright, is it A, phenylketonuria, B. Alkaptonuria, C. Homocystinuria, or D. Tyrosinosis. Okay, excuse me. What are essential amino acids? Which essential amino acids are there? Just try and understand, try and recall all of this and then answer. Okay, I'm going to give you 2 full minutes to consider this and then answer. Okay. Come on, guys, do try and answer the correct question. You have to answer in the chat section only, guys. You have to answer in the chat section, right? All right. I think now enough time has been given. Just about 15 more seconds. Okay. So, what are essential amino acids? Essential amino acids are those which cannot be synthesized in the body. Okay, which cannot be synthesized in the body in sufficient amounts for normal processes to take place. Okay, all right. So, they are required essentially in the diet. Required essentially in the diet. Okay, now what are these essential amino acids? I so like looking at trio tripping across valley, making phenomenal history. Okay, so these are the essential amino acids. This is the mnemonic, and I'm going to tell you which of these are which are these acids. Okay, what do these mnemonics stand for? Iso is, as the name suggests, isoleucine. Like is lysine, basic amino acid present in histones. Looking, leucine. Triothreonine. Tripping, tryptophan. Look at this carefully. There are 3 amino acids starting from T, but only 2 of them are essential. Therefore, this question, which of these, under which of these conditions will tyrosine behave as an essential amino acid? Normally, tyrosine is not an essential amino acid. Okay. Across, why have I put it in square brackets? Because it is semi-essential. Okay. Across is semi-essential. Alright. Sorry, arginine is semi-essential. Valley is valine. Making, methionine, efficient in pulses. Phenomenal, phenylalanine. History, histidine. Understood? So just look at it. Isoleucine, lysine, leucine, threonine, tryptophan, arginine, valine, methionine, phenylalanine, and histidine. All of these are essential amino acids, with arginine being semi-essential. Okay. Now, phenylalanine. How is if tyrosine is not a if tyrosine is not an essential amino acid, then how is it synthesized in our body? This should be your question. Okay, I will tell you the synthesis of tyrosine. Phenylalanine gets converted to tyrosine in the body by the action of an enzyme and an important cofactor. The enzyme is phenylalanine hydroxylase and the cofactor is tetrahydrobiopterin. Understood? Okay. So phenylalanine is a large neutral amino acid. Okay. And this is required in the brain for synthesis of a lot of neurotransmitters. Okay. Now, whenever this phenylalanine hydroxylase is absent, when phenylalanine hydroxylase is absent, is deficient, what will happen? Phenylalanine will not get converted to tyrosine, and all the phenylalanine that we are taking in the diet, why? Because remember, phenylalanine cannot be synthesized inside our body, so it can only be present in the body through diet. So whatever we are taking in the diet, it will get accumulated. Why? Because it cannot be converted to tyrosine. So what will happen? Excess of phenylalanine will be there and deficiency of tyrosine will. Now, excess of phenylalanine is going to cause what? The other large neutral amino acids like tryptophan, all these, they will be competitively inhibited from crossing the blood-brain barrier. Therefore, they are roaming about in the blood, all these amino acids. And this phenylalanine, because its concentration has increased so much that it will compete with all the other large neutral amino acids, and this phenylalanine, its concentration has increased so much that it is present everywhere. So much concentration has increased for phenylalanine that it is going to compete with the other large neutral amino acids for the transporter. This is the large neutral amino acid transporter. So it allows these large neutral amino acids to move from the blood to the brain. This is the brain. So only phenylalanine will be crowding about here, and it will only go to the brain from the large neutral amino acid. So the other essential large neutral amino acids cannot cross. Therefore, the neurotransmitters cannot be produced, and what will happen? There will be neurological symptoms. What type of neurological symptoms will occur? Like there will be developmental delay, there will be cognitive loss, there can be seizures, excuse me. And also due to excess of phenylalanine, there is musty odor. Also, one important symptom is ADHD, attention deficit hyperactivity disorder is also there. Okay, understood. This is also one important this is also one very important symptom. Okay, now due to deficiency of tyrosine, if tyrosine is not getting produced in the body, where will you require tyrosine from? Tyrosine will be required from the diet only. Okay, if tyrosine is not present in the body, not getting formed in the body, you will want it from the diet. So if something is not getting produced in the body in the right quantity and you are requiring that from the diet, what is it known as? Essential. So, under phenylketonuria, what is phenylketonuria? When phenylalanine is not converted to tyrosine, it becomes excess. So, this phenylalanine, this is an amino acid. Phenylalanine is an amino acid. Okay. Jatin, BBB is the blood-brain barrier. Okay. BBB is the blood-brain barrier. What this blood-brain barrier does is there are a lot of components present in the blood. Okay, they cannot be freely allowed to go to the brain. Okay, so there is a blood-brain barrier. Similarly, there is a blood-retinal barrier also, so that the substances that are present in the vascular tissues are not allowed to freely enter the neural tissues where they can cause toxicity. So they are filtered. Only certain substances which are allowed to cross this barrier can go to the neural tissue. Like blood-brain barrier is there. Similarly, blood-retinal barrier is also there because retina is also a neural tissue. Understood this? Blood-brain barrier is composed of some layers that you will read in your neuroanatomy. Okay. So this like endothelium of capillary, all these things are involved in forming the blood-brain barrier. Now this phenylalanine is an amino acid. It gets converted to phenyl ketone, which is a ketone. That is a keto acid. Sorry, it gets converted into a phenyl keto acid. What is this keto acid? Phenyl pyruvate. Alanine transaminating into pyruvate. Okay, alanine transaminates into phenyl pyruvate. You remember, we studied transamination. We studied how pyruvate and alanine can transaminate into each other. So this pyruvate, what is pyruvic acid? It is a keto acid. So conversion of amino acid to keto acid and vice versa is called transamination. Similarly, that is what is happening here. Okay. So this phenyl pyruvate then gets excreted in the urine to cause phenytonuria. What is the ketone here? Phenyl pyruvate. Okay, understood this? So these were the two questions which we discussed. Now let us take a break for some time. Then we'll join in the next session. The next session is, it will get a bit delayed, guys. I'll take that at around 9. Okay, I'll take that session at around 9. So please do stay tuned for that session. I'll be taking the next 2QPD session at 9 p.m. Okay. Alright, if you haven't subscribed to this channel, then do subscribe to it and stay tuned for further such interesting sessions. Okay.